The blood bank is of Homa Bay. For a long time, residents there would have to wait for more than a week for results of their blood tests from hospitals.
But this waiting period has been significantly cut to just 24 hours, thanks to an intervention by the Doctors Without Borders that relies on motorcycle riders to ferry blood samples from source to labs known as hubs.
And as NTV's Sharon Baranga reports, there are plans to replicate this idea to other parts of the country.
When it comes to interventions surrounding management of HIV in the country, they all began from this place, Homa Bay County, from free distribution of ARVs in 2001 and now a discharge clinic whose main mandate is to do follow-ups for patients who have been discharged from Homa Bay County Referral Hospital. And now another intervention is transforming the healthcare landscape in this county. These are not your ordinary motorcycle riders. In Homa Bay County, their mission is deadly serious. They are the link between residents of this county and laboratories that are known to many here as hubs. And they carry not just the vital supplies, but also the hopes of a people.
Why the motorbike? Because of the terrain of the area, and also we wanted something that is sustainable for Ministry of Health to be able to adapt it into their system when we hand over as partners.
The program mainly depends on 5 motorcyclists who move around 38 facilities in 5 wards in Ndhiwa. They transport blood samples from source hospitals to laboratories known as hubs, making it convenient for patients. Jared Osumba has been a rider for the last 2 years.
Imenisaidia kimaisha kujikimu, kujiendeleza. Tumepelekwa training kuhusu especially kujikinga, kuhandle samples, different types of sample, kutumia gloves.
One motorbike rider would cover a minimum of 8 and a maximum of 11 facilities in terms of collecting the samples and delivering the results.
Before the support transport network system was introduced, all samples will be taken to Ndhiwa Sub-County Hospital.
It will be taken to probably Cambry or Walter Reed, depending on the national selection. Then that would mean someone would wait for 3 months for a simple test. Clinicians would wait for maybe 2 weeks, like for a test that can take 90 minutes.
The main hospital that could do this was Ndhiwa Sub-County, which was having 43 facilities. So you can imagine all the clients in all the 43 facilities were depending on one institution to do this. But today we have 5 hubs, which has been established with collaboration with MSF France and the county government of Homa Bay. So the clients doesn't have to travel to get the results. So the turnaround time being shorter, it means decision can be made quickly. If a patient is failing treatment, the faster you identify the treatment failure, the better for the patient.
There are plans to replicate this idea to other parts of the country. Sharon Baranga, NTV, in Homa Bay County.